therefore marking, I would say, a very, very important step in, I would say, mutually in the directions of both our organizations to take a step towards a safer, a safer care, as well as for making our environment safe. I must congratulate the Society for Anesthesiology, because let's say you are one of the very pioneers for taking steps towards making patient care safer. Out of the various clinical disciplines, it is anesthesia which has been focusing on providing the amount of progress that has been made in making surgery safe by the anesthesiologists is tremendous. And therefore, this particular step now to make our environment safe by adopting alternative routes and methods by which the greenhouse gas emissions can be reduced and we can reach to our target of the carbon neutrality. I think this is a great, great day, and I must kind of compliment all of you. And we are very proud of this association with the Indian Society of Anesthesiologists. I wish this particular initiative a great success. Thank you very much.
Thank you, sir. It is my great privilege to welcome Dr. J. Bala Venkata Subramaniam. Sir is a senior consultant and academic director, Department of Anesthesia and Perioperative Care, Ganga Hospital and Medical Center, Coimbatore. He also holds a prestigious cap of being the president of the Indian Society of Anesthesiologists. Over to you, sir, for the further proceedings.
Thank you so much, madam. It's indeed a great honor to request the Honorary Secretary of Indian Society of Anesthesiologists and the person who is involved as the academic registrar of the College of Indian Society of Anesthesiologists, Dr. Sukhminderjit Singh Bajwa, to welcome the entire gathering on behalf of the national body, Indian Society of Anesthesiologists. It's indeed a great pleasure for us to collaborate with the organization which strives for patient safety and excellence, CAHO. Over to Dr. Sukhminderjit Singh Bajwa.
Thank you, Dr. Bala Venkat, sir. It is indeed a matter of pride today. We are having a joint second venture with the CAHO at the national level, and greetings from ISA national headquarters. The first venture we had in Chennai on 8th June, when we regarding the patient safety, we had a very good CME there. That was a very impressive CME. The efforts of Indian Society of Anesthesiologists in taking to the greener pasture, the greener anesthesia, and they have begun a long time ago. And every year there has been enhancing our progress toward this planet safety, the patient safety, and the green anesthesia. The society, which is almost second to the IMA in India, is committed through its member to bring this change to reduce the carbon footprints at the global level. Last year, not this year only, not even last year, our president, the immediate past president, now Vice Chancellor of College of ISA, Dr. Divetya, he also began this endeavor of the planet safety, and we had a very huge response when we conducted on Environment Day, the ISA national contest for a greener anesthesia. I think it was the first of its kind at the global level. Almost more than 500 brains came out with the brainstorming ideas, innovations, how to bring a planet to safety, how the anesthesia can be more secure, more safe for patients as well as for the planet. And I request Bala Venkat sir also, in the coming days, we have to imbibe that report to take it to the WFSA level, so that what India is doing, what Indians can do at the global level, how they have an imprint upon these endeavors, that should be visible to the world. Now, I think the battle is drawn, very clearly drawn across the social, clinical, and behavioral aspects on all fronts. And we as anesthesiologists, I know we will even associate with the ISA, the organization will leave no stone unturned. And definitely in this year itself, we are going to make a huge impact upon this aspect of greener anesthesia. And with Dr. Bala Venkat sir sitting as a secretary of WFSA, I think a connecting link between the globe and India, we will be, I think, with a so huge number of anesthesiologists, we will be leading this on this front. And I wish all the members of our country, of ISA members of country, are very best for taking this endeavor into their hands, and we are going to be very successful in that. I'm very sure about it. And I always end my speech saying, long live ISA, and hand over back to Dr. Bala Venkat sir for with my request to take this to global level from our Indian perspective.
Thank you. Thank you so much, Dr. Bajwa, for that introduction and the welcome note. And I'm very confident Indian Society of Anesthesiologists with close to 50,000 life members and CAHO with about 50,000 hospital under their belt. We will form a considerable coalition and we'll move forward in making sure that what we stand for is accomplished. I next request the Governing Council member of Indian Society of Anesthesiologists and the Dean of College of Indian Society of Anesthesia, Dr. Indrani Hemant Kumar, who has been the one who is pioneering to create a guideline for our national body, to share her thoughts briefly. Over to Dr. Indrani.
Thank you, sir, and good evening, everybody. It is with great pleasure that I welcome you all to this webinar hosted under the auspices of Indian College of Anesthesiologists and CAHO, my first as Dean of Indian College of Anesthesiologists. Today, we gather not just as healthcare professionals, but as custodians of our planet to explore a subject that holds immense relevance in our field: green anesthesia and environmental safety initiatives. As anesthesiologists, we are privileged to save lives and alleviate suffering. But it is equally our responsibility to ensure that our practice do not come at a cost to the health of our planet. The operating room, as we know, is one of the most resource-intensive area in healthcare. And from the greenhouse gases emitted by inhalational anesthetics to the significant waste generated during procedures, our environmental footprint is substantial. This webinar is a step towards a change, a step towards understanding how we can innovate, adapt, and adopt practices that are not only clinically effective, but also environmentally responsible, by examining strategies to reduce the use of high global warming potential anesthetics, implement waste management protocols, and embrace sustainable healthcare models. We can contribute meaningfully to a great future. I would like to extend my heartfelt gratitude to our distinguished speakers and panelists who have graciously agreed to share their expertise with us today, and their insights will undoubtedly inspire us to take actionable steps with our institutions and practice. Let us remember that each small change we implement can lead to a ripple effect of positive outcomes, and together we can lead the change towards a sustainable health system, one that balances patient care with environmental stewardship. Thank you once again for joining us today, and let us embark on this journey towards greener anesthesia with open mind and a shared commitment to make a difference. Long live ISA.
Thank you so much to Dr. Indrani Hemant Kumar, the Dean of College of ISA and our Governing Council member, for those introductory remarks. Now I have great pleasure in introducing the moderators for this webinar. I have great pleasure in introducing Ms. Keerthi DSouza. She is very prominent members of CAHO, and she works a lot of initiatives Sustainability Professional, Managing Director, Life Giver Professional Services, LLP, and co-chair of Healthcare Sustainability Forum. A warm welcome to you, Keerthi Madam, for being a moderator for this session. I also have great pleasure in welcoming and introducing the next moderator of this session, Dr. J.B. Divatia sir, who was the immediate past president of the Indian Society of Anesthesiologists and the current Vice Chancellor of College of Indian Society of Anesthesiologists. He is the head of critical care unit at Leelavati Hospital, Mumbai. A warm welcome to Dr. Divatia sir to moderate this session. And now, may I request Madam Keerthi DSouza to introduce the first speaker, Dr. Karan. Over to Keerthi Madam.
Thank you very much. So I take this opportunity to thank ISA and also CAHO for bringing a big gathering together through effort of collaboration towards a common cause, the common cause of sustainability. We are all thriving towards this objective, the common grounds. So I take this opportunity just before inviting Dr. Karan to take a few minutes to give a brief about how CAHO has been spearheading the sustainability initiatives in the country. So if you permit, can I just put up a slide if it's okay? So good evening, one and all. And this is a great opportunity for us for collaboration, definitely, but with a total focus on sustainability. So I take a glimpse of the journey that CAHO has had as an opportunity to explore the path of sustainability journey in the country with the hospitals. So we saw a great need for the journey of sustainability in hospitals, the healthcare organizations, because we are responsible in a great number with respect to GHG emissions or waste management or water conservation or energy conservation. So we saw that there is a huge requirement for creating the knowledge and awareness in the sector. So we took this as a challenge. We also saw that there was a need for a structured approach to understanding sustainability, to have a guidance, to see that the professionals from various organizations, various functions within the hospital understand the language of sustainability and are able to collaborate, connect, and contribute. We also saw that there were a couple of surveys that we have conducted, and we saw that there is a great need of collaboration between the functions to understand the common goal. And there is a greater role of this team coming together who can contribute. And today's session is an evidence of such collaboration CAHO has been exploring to achieve this objective. So we took the path of taking up concrete actions towards creating this awareness. So we started this activity through Healthcare Engineers Forum of CAHO. And in 2023, we had a formal launch of Sustainability Forum at CAHOCon 2023 in Kolkata. And this was received very positively, and we are working in all these areas. One is to create the awareness through various initiatives of research papers, or it is through Dialogue magazine. So we've been trying to embed the understanding of ESG among the healthcare professionals. So we have had masterclass programs. It was a 12-week program, very well received, more than 150 participants at the first program itself across the country have shown their interest, participated throughout, and collaborated further to bring in more participants in the city programs that we have had. We've had more than 4 programs in the cities. We've had pre-conference in the CAHOCon. And then beyond capacity building, we've been embedding deeply into the research path. So we have had research to understand what has been the understanding of sustainability among the healthcare professionals from various sectors and the value chain inclusive. We've also seen the understanding of sustainable procurement and its role, and we've started publishing papers in this direction. CAHO has also taken a step ahead to see the GC members. We have all had a leadership summit in Sri Lanka. So the trip that we made, we started taking the inventory of carbon emissions of the trip, the flight emissions, and seeing a collaborative approach of all GC members coming together and contributing to see how we can reduce this footprint on a personal capacity and a collective capacity. And we have neutralized that whole trip of the carbon emissions. And so further growing into partnerships, we've been looking at various value chain organizations to come together. And today's occasion is one such special moment for us. And towards a structured approach that we had to have for healthcare sector, we've been working strongly and deeply and hardly, I should say, to look at building a standard, a guideline document, and we have submitted the same to Bureau of Indian Standards. And you should shortly look at, once the committee approves, that being released as a guideline to guide the organization in a very structured approach. And every year we have been launching one improvement in terms of the award. So we've had Environmental Sustainability Award launched in CAHOCon 2023, and we are now looking forward for 2024 CAHOCon, where we're launching Sustainability Award. So this has been a glimpse of the various activities that we have taken up in terms of creating awareness very strongly. And we've seen that this awareness programs in various cities has been very enthusiastically responded by several professionals from various functions and departments and across the value chain. That is the important message CAHO has been trying to put forward. And this BIS standard is going to be an eye-opener, and it's going to lay a roadmap of understanding to make that structured approach. So I take this opportunity once again to thank all the collaborations that's going to come up from this particular meeting forward. And it's a great pleasure for me to invite Dr. Karan Thakur, who is the chair of this Sustainability Forum of CAHO. He has been a very enthusiastic personality beyond the professional capacity of being a vice president at Apollo and also consulting ADB on healthcare sector sustainability matters. He is a great orator on climate change issues, and he's been into national, international forums explaining the importance of sustainability. And it's a great pleasure, Dr. Karan Thakur, for having you speak about the topic. And on behalf of all, I welcome you to this session, and over to you.
Thank you. Good evening, everyone, and thank you, Keerthi, for that very generous introduction. I'd like to, before I begin, thank the leadership, the distinguished leadership of ISA and CISA that are here. Thank you also, Vijay sir, and my colleagues at CAHO for all the encouragement that they have given over the years for us to really mainstream healthcare sustainability. And last but not the least, the expert panel of speakers that have joined. I really look forward to hearing from them. I will just put up my presentation.
Karan, Dr.
Yes.
Karan, just wanted to add before you start, I want all the participants to carefully listen to all the three speakers, because at the end of the session, we are going to have a Kahoot quiz, and the toppers will get prizes. So I just wanted to wish all the participants here the best wishes to closely follow what all the three speakers are going to share. Over to Dr. Karan.
Thank you, sir. Very important and pertinent information. In the short time that we have today, I think this is just a start of a conversation, and I'm greatly enthused at listening to some of the comments that have already been made by the distinguished leadership on why green anesthesia is important. At the at the outset, I'd like to say that we are amongst the first few in the world that are really taking this so seriously. So kudos to ISA and CISA for taking the leadership on this. Over the next 5 to 7 minutes, what I intend to do is to give a global overview of some of the trends and approaches towards healthcare sustainability and why this has become pertinent for our sector. It was touched upon previously as well, but I'll just get into some more scientific data and evidence that is presented to us. First and foremost, I think it's very important to understand that climate change is really an anthropogenic phenomena. Unfortunately, there are political movements across the world which are actually trying to compete and say that that is not true. But we are seeing that human activity is actually contributing towards climate change and significant heating of our planet. In fact, as we all know, this year was the hottest year recorded in human history, and a lot of this has to do with human activity. If you see the graph on the right-hand side of this slide, you'll see since the 1940s, but more particularly from the 2000s, there's been a significant increase in carbon dioxide emissions worldwide. And you would see, except the blip that we saw during COVID because of economic activity shutting down, there has been a secular increase in the trend. And this is particularly of significance because we consider that in the last 10 years, a lot of efforts have been made to reduce emissions, but unfortunately, because of various factors, they continue unabated. And it's also important to understand that climate change is a human crisis. The climate crisis is a health crisis. And we, as medical professionals, need to start talking about this in no other dimension but climate change as being a fundamentally an issue of human health. If you see, there is ample data that exists in terms of what the impact of climate change will be, from things like displacement of people to increased exposure of infants and the elderly, to increased climatic suitability of vector-borne diseases like malaria, or even increased mortality. There is data that suggests that from extreme weather events, mortality will increase across countries, and especially most disproportionately impacting countries and people from low and middle income backing. So this is a problem that is well within us and amongst us, and therefore the need for action. Now, there has been a lot of action, and it has been going on for very many years. In fact, the definition of sustainability is not new. It came to us in 1987 through a United Nations Commission, and it looked at, how we can meet the needs of the present without compromising the ability of future generations to meet their own needs. So fundamentally, that definition has held us in good stead. And now we're actually talking about how we can be more regenerative. So it's not about the depletion of resources, but actually how we can regenerate those resources that we have used. There are 5 important paradigms to consider when we talk about sustainability more broadly, not healthcare sustainability in particular. One is that each country has signed up to what are called the SDGs, the Sustainable Development Goals. These are commitments that countries have made. Amongst those dimensions of 17 goals that we have, climate action is one of them, as is good health and well-being. And many of you would have heard of the Paris Agreement of 2015. This was a seminal agreement that was now nearly a decade old, which really brought in the language of becoming net zero or carbon neutral as a country, as an economy, and also urged countries to put forward their own nationally determined contributions. How does this impact us? Well, in COP26, which was held a couple of years after the Paris Agreement, which is, as you know, is a collection of countries coming together on climate issues, India put forth what was called Panchamrit, 5 goals that we are to achieve by 2030, and each sector needs to contribute towards those. And a major chunk of that was to actually decarbonize our operations. So that is really the genesis of why this becomes important, both as a national goal and why the health sector needs to contribute towards it. Last year, we had a significant progress made both at COP28, which happened in Dubai, where there was a specific climate and health day. So there's recognition of the importance of the health sector in this. And most recently at the G20 that was held in New Delhi, countries actually signed up for a collective commitment towards an inclusive, adapted, resilient, and low carbon sustainable health system. So this is a commitment that we as a G20 country have also made. Now, if you see why this is a problem within the sector globally and in India, healthcare emissions account for about 5% of global emissions. If we were a country, we would be the 5th largest emitter. Surprisingly, we are, as a sector, even larger than shipping in terms of emissions. So our footprint is quite significant. Where does that footprint really come from? Well, it is in the delivery of care, obviously, but also because of our value chain, which is something that Keerthi also spoke about, and the need to collaborate, because this is not just something that we can do on our own. Close to about 60% of our emissions come from the supply chain, and that's where we at the healthcare community need to urge our value chain partners to also partner with us on this journey. And, we also release toxins, waste, and also generate biomedical waste, which itself has a toxic and, emittive character. Just an example, a single CABG done at any of our hospitals, just a single procedure CABG that you would do releases carbon dioxide equivalent of a small petrol car traveling 250 kilometers. So you can imagine when you multiply what the impact we are having, it's great, it's wide, and it's every day. Now let's juxtapose this. We've spoken about emissions, where we stand as the healthcare community. If you see globally, the carbon emissions, China and India are really outliers here because of our population size. But when you see per capita or the emissions that the health sector does, India is still very low. Does that mean that we don't need to worry about this? Because per capita can sometimes give us a mixed picture. When you look at the expansion of the health services that are projected for the next 20 years, this 2% is expected to rise to somewhere between 5 to 7% if we don't act. So while we are a low emitter at the moment on per capita basis, as the health sector grows, it needs to grow green. And why we need to do that is fundamentally because, as I said, climate change is a health crisis. And I don't need to go into the details of this. You can very clearly see the evidence of what climate change is doing in terms of causing climatic events like air pollution, extreme heat, and so on, and how this is impacting human health, which is the outer ring of this slide. So no aspect of human health is immune to climate change. Our estimate is that today, if you have a particular disease, climate change is making it worse. 10 years from now, climate change will contribute to either causing a disease or making it worse. So this is a clear and present issue that we need to be talking about. I want to spend a minute on what some other models exist out there for us to probably take some learnings. The NHS, I'm sure a lot of members of ISA and CISA have worked in the NHS system, was in fact the first to actually bring a law for the NHS to work towards net zero. And a major contribution towards that is coming through both the practices, clinical practices broadly, but specifically from also the OTs and the ICUs. So again, the NHS is a very good example when we compare it to systems like the United States, which only talks about voluntary pledges, or other systems like Germany and France, which really don't even have any sort of target set out. So the NHS is something, since many of us would be familiar with it, to look at in terms of what actions there are. This document, which I'll be happy to share with the Secretariat and could be circulated amongst the ISA members, talks about how that delivery of the net zero commitment, which the NHS has committed to becoming net zero by 2040, and the clinical practices that they need to deploy, are listed out here, and something that we can actually learn from and implement in our own settings, both as a professional practice of anesthetists, but also within our hospitals and broadly in our health systems. The Indian healthcare sustainability scenario is now gradually becoming more structured and moving towards some bit of maturity, but it needs far more focus than what we currently have. There is a focus on mitigation, which is to reduce our carbon footprint, to decarbonize, to reduce the amount of carbon we use or generate through our processes, and also have an India context adaptation of that. There is also an increase in the number of disclosures that hospitals now need to make. So willy-nilly, there is a compliance framework that is being built in. If you're a listed entity, you would have certain compliances that you need to report on. If you're a not-for-profit, then again, there are some compliances which are baking in aspects of sustainability. So now it is not just a good to do, but just to get compliances of your institution, this will be a must do. And as Keerthi touched upon, BIS, Joint Commission International, and the NABH now have sustainability specific standards, which will come into, which will be enforced from 2025. So if your institution is undergoing an NABH reaccreditation, please do be mindful that there will be sustainability standards that are being built in there. So again, there is a move towards getting compliance, or sustainability within the compliance framework. And as we are doing right now, there are some capacity building initiatives, this being one great leap forward in that. And we hope to work with like-minded institutions to do that further. But we need a lot more data, and therefore research. We are really looking out for any type of research that any practitioner or hospital or institution wants to bring out. Happy to partner so that we can publish data on what is an effective strategy towards decarbonization. And we need to do this while there are challenges that exist. How do we change current clinical practices to become less carbon intensive? What do we do about single-use plastics? We have a disposable culture, especially after COVID, that has come rampaging back. How do we go back to a status quo ante? There are market dynamics. How do we create a market that is conducive towards decarbonized or low carbon products? And that push will only come from practitioners like those who are gathered here today. And then there are inherent challenges. Why focus on sustainability when affordability, access, and equity are issues? And who funds this? So these are some of the issues that I wanted to give a broad picture of where we are globally, why this is a pertinent issue, why we need to act, why is it a pertinent issue within healthcare, what are some of the progress that we have seen, and what the way forward could look like, with one example coming from the NHS. And I'd just like to end with this quote from Robert Swan, that the greatest threat to our planet is the belief that somebody else will save it. And I think it's incumbent on the community of practitioners and the healthcare sector to really now step up to the plate, because the responsibility is everybody's, not just one individual's. I'll just stop there. Happy to take questions at the end of the speaker's notes. Thank you.
Thank you so much, Karan, for bringing in some very, very important and salient note. And I think the way we both have collaborated, the CAHO and ISA, it's probably the someone is probably we both for this country. And I'm looking forward for all that you said about capacity building, research, and take it forward and to create a sustainable system that we will integrate into our day-to-day practice. Thank you so much, Karan, for that excellent insights. And now may I request the moderator, Dr. Divatia, the immediate past president and academic chairman and the vice chancellor of the College of ISA, to share a couple of his thoughts and introduce the next speaker, Dr. Subramaniam Ankali. Over to Dr. Jiggy Divatia, sir.